Hi, I'm Lauren Ralph. I'm an epidemiologist and the Associate Professor of Obstetrics, Gynecology, and Reproductive Sciences at UCSF. And I'm excited to be with you today to share findings from the Turnaway study on how receiving or being denied a wanted abortion is associated with maternal and physical health. So most prior research on this topic, on the morbidity and mortality associated with pregnancy, has focused on documenting the immediate or short-term health effects of both childbirth and abortion. And these studies clearly demonstrate that if you compare the two most common outcomes of pregnancy, giving birth or having an abortion, there are more health risks associated with childbirth. So giving birth is associated with more gestational hypertensive disorders, more infections, more hemorrhaging, and ultimately a higher rate of mortality than having an abortion. But a challenge to any study that compares the safety or physical health consequences of childbirth versus abortion is something called the healthy mother effect. Namely that pregnant people in good health may be more likely to continue a pregnancy than have an abortion. And therefore any differences that we observe in the health outcomes of these two groups over time is actually a reflection of their pre-pregnancy differences in health status. And overall, this selection bias may have underestimated or downplayed the relative safety of abortion compared to childbirth. So we need research where we have two groups of pregnant people who are as similar as possible, but almost randomly, some of them give birth and some of them have an abortion. And that's where the Turnaway study is able to offer critical new evidence on the maternal and physical health consequences of childbirth and abortion, both in the short and long term. So as you may recall from other lectures in this series, the Turnaway study recruited people seeking abortions at over 30 facilities across the US. And participants were recruited into three distinct groups. The first in green were turnaways, people who were denied the abortion that they sought because they presented just after the gestational age limit for care in that setting, and they went on to give birth. The second were the near limit abortions in blue, people who presented just before the gestational age limit and received their wanted abortion. And finally, there was a third group in orange that presented and received abortion care in the first trimester, which is when the vast majority of women in the US get their abortions. My colleague, Dr. Caitlin Gertz, looked at some of the short-term differences in health status among Turnaway study participants in a 2016 article in Women's Health Issues. And she and her colleagues found that people who gave birth after being denied an abortion reported potentially life-threatening complications such as eclampsia and postpartum hemorrhage, whereas those having abortions largely did not. In addition, they found that women who gave birth after being denied a wanted abortion reported the need to limit their physical activity for a longer period of time than women who received their abortions. Interestingly, there were no differences in the frequency with which participants reported any side effects or health problems between the study groups, but this lack of difference may, at least in part, be due to when participants completed their interviews. So whereas people who had an abortion had done so at about 8 days ago, people in the childbirth group may have given birth several months before. And based on the specific side effects that they described, it was clear that those experienced by people giving birth were more severe. So those were the effects in the short term, but there is much less research focused on the longer term physical health consequences of abortion versus childbirth. So whereas most of past research has focused here in the postpartum or post-abortion period, the Turnaway study offers the unique opportunity as a multi-year longitudinal study to examine people's physical health up to 5 years after they received or were denied an abortion. And when looking at some of the longer term physical health consequences of abortion and childbirth, we treated our study group somewhat differently than other analyses presented in this series. So one group was exactly the same, the people who gave birth after being denied a wanted abortion, the Turnaways, again here denoted in green. But for those who had an abortion, we grouped people according to whether the abortion happened in the first or second trimester. So this allowed us to look at two contrasts. First, we wanted to see if there were any differences in health status between people who gave birth compared to those who had an abortion overall. And second, we wanted to hone in just on those who had an abortion and look to see if there were any differences in long-term health between those who had a first versus a second trimester abortion. And our motivation for this last contrast was that the National Academies of Science, Engineering, and Medicine recently described in their 2018 report on the safety and quality of abortion care in the US, that the longer term safety of later or second trimester abortion is an understudied area. And so we were able in this study to contribute new evidence in this area. So the first thing that we looked at in our analysis was whether we had a sample that, at least on factors that might influence someone's physical health over 5 years, were relatively equal or balanced at baseline. And largely they were. So about 1 in 5 participants across all study groups reported that their pre-pregnancy health was either fair or poor. They had comparable lifetime experience with a serious illness or injury. And in general, they reported similar levels of chronic health conditions such as asthma, hypertension, and cardiovascular disease at the time they joined our study. Where they did differ was in their history of giving birth prior to the study. So those who had an abortion, whether in the first or second trimester, were more likely to have ever given birth. And relatedly, they were also slightly older on average than those who gave birth in the context of the present study. So we adjust for these differences, as well as other factors that we hypothesize could confound or bias the relationship between abortion and physical health in all of our models. Our first set of outcomes was focused on chronic pain, defined as pain lasting longer than 6 months. So we asked participants about their chronic pain at every interview and about various forms, including abdominal, pelvic, osteoarthritic, headaches, head, and back pain, and other pain. And we used mixed effects longitudinal logistic regression models to examine trajectories of chronic pain over time. Specifically, what proportion within each study group reported experiencing that type of chronic pain over the last 6 months. I'll walk you through a few of the findings. The first thing to notice here is that the overall trajectories look fairly similar by study group, and that is especially true if you compare the purple and orange lines, so the people who had either a first or second trimester abortion. So there were no statistically significant differences in chronic pain trajectories between people having first and second trimester abortions. The second thing to note, though, is that when differences did emerge between the study groups, they were consistently in the direction of more chronic pain among those who gave birth. So for chronic joint pain, chronic back pain, and chronic headaches or migraines, those who gave birth fared worse over 5 years, and these differences were statistically significant. So in addition to specific types of chronic pain, we also asked a more global measure of physical health. So at baseline, we asked participants how they would rate their overall physical health just before they became pregnant. And then at all interviews, we asked them how they would rate their physical health now, so how they rate their current health. And on the surface, this seems like a very simple measure, but interestingly, this measure of self-rated health is unusually and strongly predictive of future health and mortality. So what seems like a very straightforward and simple question is in fact strongly associated with a person's current and future health. And when we looked over time in adjusted models, we saw that people who gave birth were significantly more likely to report being in fair or poor health versus good or very good health over 5 years. And whereas rated health stayed fairly stable over time and actually even improved slightly for people in the orange line, or the first trimester group, the proportion in fair or poor health increased over time for those who gave birth, and at a steeper rate. Finally, we asked participants a very brief health history, specifically whether a healthcare provider had ever told them that they had any of the following chronic conditions. And we asked this at baseline about their lifetime history with these conditions. And then over follow-up, we asked people whether a doctor or nurse or other healthcare provider had told them that they had the condition in the last 6 months, so a new diagnosis. For 2 of these conditions, we asked people a follow-up question about whether it occurred only during a pregnancy. So new diagnoses of chronic conditions such as asthma, hyperlipidemia, diabetes, and hypertension were generally not common over the 5 years of follow-up and largely did not differ by study group. So one exception was gestational hypertension, where we saw that new diagnoses of this condition were higher among people who gave birth, the blue bar. So in addition to all of the morbidities just described, we also tracked mortality of study participants through both a verbal autopsy protocol and a systematic public record search. And there were just over 1,100 people who consented to participate in this study. And in that sample, we identified 8 deaths. And for each death reported, we assessed a cause and defined a death as maternal or pregnancy-related, using criteria established by the WHO. So 2 of the deaths that we identified were maternal deaths, or deaths due to pregnancy. And both of these deaths occurred to women who gave birth after being denied an abortion. There were no maternal or pregnancy-related deaths in the women who had abortions in this study. In the US, even though our maternal mortality rate is high and of concern is on the rise, a maternal death in any given pregnancy is still an uncommon event. So less than 2 in every 10,000 women die in childbirth each year. But in this study, approximately 1% of women giving birth died. Now, because this outcome is so rare, we can't assess whether this difference is statistically significant. But at the very least, we can say that these maternal deaths might have been avoided had these women had access to the healthcare that they sought. So when we asked Turnaway study participants why they wanted to have an abortion rather than continue the pregnancy, one of the reasons they cite is their own physical health. And their concerns are borne out in the data. In the short term, those giving birth experience more life-threatening complications and more limitations on their physical activity. And in the long term, when differences did emerge between the groups, they were consistently in the direction of worse health among those giving birth. And this was true for various forms of chronic pain, and perhaps most importantly, for their overall perception of their health status. Reassuringly, we saw no differences in chronic pain over time between people who had a first or a second trimester abortion. So this study adds new and reassuring evidence about the safety of later abortion. And finally, although descriptive in nature given the sample size, the 2 maternal deaths in this study are a reminder of one of the more serious consequences of denying people access to a wanted abortion. For more information about the data presented here, please see our 2019 paper in Annals of Internal Medicine, the 2016 paper in Women's Health Issues, or don't hesitate to contact me at lauren.ralph@ucsf.edu. Thank you.